Okay, everybody right to go? Very good. Thanks for joining us for the daily update. We have 3,967 cases of coronavirus in Victoria. That is 177 new cases since we last updated you. 25 of those 177 are connected to contained outbreaks. 151 of those cases are under investigation by our dedicated public health team, and one is from hotel quarantine. We have, yesterday we had 22,943 tests, and again I want to thank every one of those people and indeed every Victorian who in such unprecedented numbers is coming forward to get tested. As I've said so many times, but we'll keep saying because it really is a critical point, that's in some ways the most important contribution people can make. If you've got symptoms, even mild symptoms, come forward, get tested. There's more than 150 test sites open right across the entire state. That surveillance, that data, that information allows us to deal with the very clever enemy that we are up against, a virus that spreads rapidly, a virus that will defeat us if we don't have the best information and, of course, Victorians following the rules. To that end, can I again extend my profound gratitude, my thanks to every single Victorian who is doing the right thing. That's the vast majority of people across our city, across our suburbs, right across our state. It's a powerful contribution that you're making. I said yesterday, and I'll again make the point, our nurses, our doctors, our ambos, all of those clinical staff, we shouldn't see them as the front line in our war against this virus, our battle against this virus. They're the last line of defence, and we can't leave it to them treating patients in intensive care. They are not really, they ought to be seen and we should be grateful in every sense for the work that they do, but we've got to see ourselves, each of us, as the real front line in our fight against this virus. And the way we can make the best and most powerful contribution is to follow those rules, do the right thing, exercise good judgment, use common sense, and of course come forward and get tested even if you've got the mildest of symptoms. Our health workers are heroes. They do an amazing job. If we want to thank them, one of the ways we thank them is by acknowledging that it is us that is on the front line. We are there, and if we follow the rules, then we can play our part, a really powerful part in driving down these numbers, driving them down to a controlled and contained level, and then being able to move beyond the very difficult and challenging circumstances that we face at this time. With 22,943 tests being conducted yesterday, that takes our total test number to 1,148,357. That is an enormous amount of testing. That testing rate is among one of the highest per 100,000 anywhere in the world. And again, I'm very, very grateful to everybody who has come forward and got tested. Please keep coming forward to get tested if you have even the mildest symptoms. It lets us know where the problem is, how we can deal with it, how we can trace and provide the best public health response. We have 72 Victorians in hospital. 17 of those are receiving intensive care, and there are 1,612 active cases across the state. The key point, again, to emphasise is that, of course, driving in this morning, freeways, very, very light traffic. We're seeing lots of places that would normally be hosting large numbers of people. We're seeing very small numbers of people out and about. That says to me, plus not just the anecdotal, but the actual data that we get around mobility and movement, we are seeing people moderate their behaviour. They're changing their behaviour significantly. That's what being on the front line in our fight against this virus is all about. Everyone making a contribution for you, for your family, for your community, for every family and the entire state. If we all keep following those rules, then this strategy will work. We will bring this under control. We will be able to resume opening up. We'll get past this very difficult set of circumstances we face. To the vast majority of people who are doing the right thing, I again say thank you so very much. To those who aren't, Victoria Police, as I said yesterday, and I'll keep on saying it, Victoria Police, the last time they issued many more warnings than fines. They're not mucking about. The time for warnings is over. They'll always use good judgment, fair judgment, but if you are out there just breaking the rules and you're betting that you won't get caught, the odds are not good. You will get caught and you will be fined. So please, it doesn't have to come to that. It really doesn't. If everyone just plays their part, uses common sense and good judgment, if people, again, acknowledge that the front line of this virus fight is every individual, every family, every community, it's not good enough for us to just rely upon our doctors and nurses in hospitals to be the ultimate defence against this thing. We've got to stop it getting to that point. We've got to stop it getting to the point where we have thousands of people in hospital and hundreds of people needing a machine to breathe. I will also just make the point as well, we've seen tragedy obviously over these last 6 months. The world has seen tragedy as well. It's not just an illness of the frail aged, not that that makes it any easier to deal with, but I have a message for every single Victorian. This has taken the life of otherwise healthy people of all age groups. The notion that this is simply something that will be tragic if you are very ill already and very old, that is simply not right. This can have catastrophic outcomes, tragic outcomes for people who are otherwise healthy and for people in any age group. On that basis, we all have a part to play to make sure that we're not just relying upon our nurses and doctors to get this job done. We all have to acknowledge this is a clever enemy. It is silent in many respects. So many people have this and have very moderate symptoms. It is so wildly infectious. We've all got to play our part. That's how we will get to the other side of this. That's how we will defeat this virus. The alternative is these numbers continue to grow, and, well, that is not a situation that we want to be in at any point. This lockdown will continue for as long as it needs to, but it need not be there for a moment longer than is absolutely necessary if everybody simply follows the rules and does the right thing. And again, thanks and praise and gratitude to everyone who is doing the right thing. That's the vast majority. And to those who aren't, well, police are out there in force. Can I just make reference to the fact that Pat McGorry from Origin is here today. You'll know that we launched a roughly $60 million mental health package some time ago, and Martin Foley and Pat will speak about the way we're using technology to support the best care, particularly for younger people who are experiencing a whole range of stress. There's a significant challenge, a mental health and wellbeing challenge wrapped up in all of these measures and the fight that we're in. And Pat and Martin will speak to that in just a moment. Before they do that, it is perhaps best if Brett just adds to my daily update, and then Martin will speak, and then we can take any questions. And I think Pat and others from Origin are available to give you some comments at the end of our press conference. Brett, you can go next.
Thank you, Premier. So 177 new cases today, clearly lower than the maximum number that we've had on any one day. I think I've always been calm in these presses, but I have never been complacent. I'm not going to be complacent about today's number. It's great that it's lower than our peak, but it may not be our peak yet. So I would like to see a week of decreasing numbers before I come and say that I've got greater comfort about the direction we're going in. But as a reflection of the actions that people took a week or more ago, I think it probably is a good sign that this is exactly what happens when people are following the stay-at-home directions, isolating and testing appropriately and minimising their contact with others. This is exactly what we will see as people do the right thing, and it will continue to drive down if those behaviours are sustained. So that's a small bit of optimism in today's numbers. With respect to outbreaks, and again, you know, there are 4 or 5 new outbreaks every day. The numbers change significantly, and with close to 200 new cases, the linkages that happen over subsequent days always change those numbers. But I'm aware of 6 cases linked to La Mana supermarket in Essendon, 12 cases linked to Somerville Meats. That setting is closed. But these are cases that are subsequently cropping up in all of the staff who are in quarantine. 8 cases linked to Senvic Construction in Footscray. Riverina Apartments, they're called. 26 cases linked to Menorock Life Aged Care Facility in Essendon. That's a big aged care outbreak. A number of staff and a number of residents have become infected in that outbreak, but that's being very intensively managed at the moment, including transfer of some residents to acute care. 13 cases linked to Glendale Aged Care Facility in Werribee. 144 cases linked to the Al Taqwa College outbreak, and we've got 2 cases linked to Japara Central Park Aged Care in Windsor. So again, aged care not surprisingly represented in outbreaks. The vast majority of our aged care outbreaks have involved 1 or sometimes 2 staff and no residents. Again, that's a measure of staff identifying themselves as soon as they become unwell, and very extensive testing of residents and lockdown in those aged care facilities. But they are critically vulnerable, and we need to manage them as closely as we possibly can.
Thanks. So we know that doing the right thing and following the rules and staying apart and following the social distancing guidelines is the right thing to do to drive the curve of infections back down. But we know that it also comes at a cost sometimes of mental health and well-being. That is why earlier this year we, as part of the initial pandemic response, funded a $59.4 million package to support not just frontline services, Beyond Blue, Lifeline, Smiling Minds and a whole heap of other frontline phone, digital and community-based services. But we also funded Origin. Origin Youth Mental Health Services is the world's leading practice and research institute and provider for youth mental health services. And we funded them to bring on their eOrigin platform to deliver services for those young people 16 to 24, funded that age group to deliver online supported mental health practice and support to get them through these tough times. And it's part of the $59.4 million package was $6 million to Origin to deliver that service in partnership with Headspace and a whole range of other specialist youth mental health providers. So I'm really pleased today that in a record period of time that Origin are now launching the MOST platform, MOST standing for Modulated Online Social Therapy Platform. It's not an app, it's a real world provision of services that meet the needs of mildly or acutely unwell young people to get the support they need in a safe and indeed sometimes quicker way than they would in any other measure. It's initially going to be rolled out in the north and western suburbs of Melbourne. It will be rolled out, and I'm pleased to say that in partnership with the mental health providers in the Flemington and North Melbourne communities will be specifically available to young people in those towers and their communities via their community mental health provider, CoHealth and other providers. And it will be there to take young people through all the supports they need, whether it be that therapy for mild or acute mental illnesses, whether it be through support for peer-based worker and other supports, whether it be for vocational support, whether it be for recovery and resilience support. All the things that Origin and Headspace are world famous for in the real world will now be online and progressively rolled out over the rest of Victoria over coming months ahead across all availabilities for young people in those areas. We know that it's a tough time for mental health and wellbeing, particularly for young people. We know that 70% of mental health presentation conditions that occur later in life first present in this age bracket. So it is so important to get this facility and this service out in those high needs communities first and then progressively rolled out across the rest of the state. This is in addition to a whole range of the pandemic mental health responses that we are delivering. whether it be through the frontline service support to Beyond Blue, Lifeline, Suicide Prevention Line, specialist providers for perinatal and maternal mental health support, eating disorders, a whole range of specialist programs as well. We know that doing the right thing when it comes to social distancing and driving this curve down again is the right thing to do, and we will be there, particularly for young people, to make sure that we give them every assistance and every guidance to make sure they get through this and that they come back stronger and better than ever. I might leave some initial comments there, and I'm sure Professor McGorry and his team would be more than happy to answer in a lot more specific detail than I possibly could.
Happy to take any questions you have.
Just to clarify from Brett, you said 144 cases linked to outside for as part of those outbreaks. Is that what the cumulative figure so far?
Well, I might have something more specific. Yes, I understand that it's the cumulative figure. 28 are in staff, 76 are in students, 16 are close contacts who will be in the households of those staff or students. There are a further 22 under investigation.
So how many new cases today are linked?
I don't know the number of new cases for today for Altuqua.
What's been done to prevent further cases in the Housing Commission towers, particularly those ones that weren't subject to the initial lockdown?
Essentially, we're really trying to roll in a public health model of response in all of the other towers that involves a real focus on prevention. So that's hand hygiene, the alcohol-based hand rubs availability, the deep cleans, the multiple high-touch surface cleaning in those environments. But the really key element is making sure that we engage with the communities within those towers, allow them to test whenever they want to, with the mildest of symptoms, and support them in their isolation and the quarantine of their close contacts. There has been much more intensive in-reach in some of the towers in Carlton, for example, where testing has really gone door to door to check in with community members to see whether anyone wants to be tested. And for a couple of towers that's included symptomatic and asymptomatic individuals, because when you've got significant numbers in a closed setting, then asymptomatic testing can be appropriate to pick up further cases. That tends not to be the case in general drive-through and community testing, but in very concentrated outbreaks, broad testing of symptomatic and asymptomatic people can be very useful, and that's happened in Carlton.
I guess I'm aware of some cases in those Carlton towers back in May, and I guess if so, should these interventions have started earlier?
I'm not sure exactly when the first cases cropped up in Carlton, for example, but all of those individual cases get the support of isolation, quarantine and follow-up of close contacts.
We're seeing abattoirs, aged care staff, public housing towers as well. Is there a concern that this virus is hitting sort of communities with lower paid, less secure workers more than the rest of us?
Yeah, absolutely. We know that pandemics can really shine a light on social inequality and economic inequality. People who have more insecure work and are really obliged to come to work are obviously more likely to turn up with mild symptoms. So it is a challenge, and we have to reach into all of those community members in order to understand how best to support them for the things that we know that will work, the isolation and quarantine. I do want to say, you know, it really is critically important not to come to work even with the mildest of symptoms. People who test positive and who require time off work in order to isolate or quarantine have the hardship payments available in Victoria. I hope that gets really broadly broadcast, because that's an important thing for everyone to understand, that you shouldn't feel obliged to come to a workplace with mild symptoms, and there are really significant consequences for outbreaks in some of those sensitive settings.
Can I just ask you on that issue? Sure. Is that something that, I don't need to make the hardship payments, but the fact that this seems to be happening in those lower paid communities, is that something that you can try and address?
Well, that's what the hardship payment is all about. There are a number of people who have to make that very difficult choice between what's good for public health and the survival of their own family. From a economic point of view, they look at their bank balance and they can't say no to the shift, they can't say no to the boss, and they will go to work even though they have mild symptoms, perhaps even worse than that. In order to avoid anybody having to make that choice, in order to ensure that everybody can put public health first, that $1,500 no questions asked hardship payment, if you don't have sick pay, if you don't have another opportunity, another avenue to have your income essentially guaranteed during your period of illness or the period that you have to isolate. I can get you an update, Rich, on how many people have actually applied for that. And I think you'll see that that's coming from a whole range of different industries, a whole range of different families, but there'll be some common links there. And I think this notion of insecure work and not necessarily having a safety net to fall back on as part of your individual employment circumstances, it can drive people making that choice to be less concerned about public health than we would like. That's why we've put that payment in. The last update I got, there were certainly many hundreds of those payments have been made, but I'm more than happy to try and get some more contemporary data for you.
I understand you've accepted the PM's offer of another 1,000 ADF troops. What will they be doing down here?
That's still being worked through in terms of the exact roles that they'll play. We're in constant discussions about whether it be Commonwealth public servants, ADF staff, anybody that can assist us regardless of what uniform they wear. In the current challenge that we face. We've got a number of requests that are outstanding. That is, we're just slowly, gradually working up to fulfil those requests that have been made some time ago. That does take time. You can't stand these things up in a matter of hours. So we've got ADF. You've seen them out there. They're doing a fantastic job alongside Victoria Police, alongside all of our emergency services, as well as our public health team. In terms of the exact deployment, the nature of that work, and how quickly those 1,000 staff will get here, I'll have to come back to you on that. That's still being worked through by people like EMV, public health team, my department and others, and of course the Chief Commissioner has got a direct role in that also.
And are you able to go through what you're doing to boost contact tracing teams? We've had reports of people getting automated messages telling them that they're eligible to leave quarantine 7 days before they actually are. What's being done to prevent
well, it's a very big team. It's a very big team, and they're making contact with an even larger number of people each and every day. And there will be, from time to time, human errors will be made. That's not the example that I'd had cited to me. It was in fact the other way around, where people were given more cautious advice than they probably should have been given. But look, it's a big team now. As I said to you the other day, it will need to continue to get bigger. I'll have some more announcements to make in relation to some Ambulance Victoria staff that will be going across there, a whole range of private sector companies who've got specialist skills from a call making, call taking, customer service, outreach point of view, people who really are well and truly skilled and versed in doing that work. That team is bigger than it's ever been, but it's going to have to get bigger, and that's exactly why we're working so closely with every Victorian government agency, as well as the Commonwealth, and indeed we have support from other states. Now, some of those team members are not in Melbourne. They're making phone calls, they're conducting detailed interviews, and that's the key, that first interview, to try and get the scope of a person's movements. Who have they been close with? Who have they come into contact with? What's the total field, if you like, of where they might have taken the virus? Those initial interviews, many of those are done in Melbourne by a big team, but there are also lots of those interviews being done from other state capitals, and we're very grateful to other state governments who've provided us with some of their very best public health physicians and public health experts to get that important job done.
I'm hearing reports of some of those interstate teams being given lists of people they need to contact, not people who have tested positive, but they're close contacts. At the end of the day, when they should have been able to contact them during the day, should that be happening? Are you in a situation where the team's just not big enough and you're playing catch up?
No, I wouldn't describe it like that at all. And what I can say to you and to all Victorians is it's a massive team, and everyone's doing the very best they can. It is challenging, always challenging. You are, after all, having to reach out and communicate with many thousands of other humans each day, and there's a whole lot of variants and vagaries and all manner of challenges in that. It's not simple work. If it were, then, well, this would be a very different challenge, wouldn't it? Not just here, but indeed right across the world. Just as New South Wales, for instance, at the moment, are having to make contact with thousands of people from one night at one pub we are having to contact thousands and thousands of people each and every day, and our team is big. It's growing further as cases grow. We're very grateful to the partnerships we have. We're very grateful to the support that we've been given, and I think you'll see that team get even bigger in the coming days and weeks, because that's exactly what the pandemic asks of us.
Have you established how many false texts went out telling people that they can leave contact information?
No, well, the report I had was that it was the other way around. People were told that they were negative, but that they should stay at home. It's a small number. I'm not entirely sure of the exact number, but it's in the order of 100 odd. I think that was the last report that I got. Let's not lose sight of the fact that there's contact being made with 8,000 people every single day. I think the advice I had was that the advice provided to those 100 or so people was more cautious rather than less. Of course, we apologise for any inconvenience, but when you're dealing with that many people in such a fast-moving and dynamic environment, I'm sure Victorians can appreciate that sometimes somebody will attach the wrong spreadsheet to a text message, and a small number in the scheme of things of errors may be made. That's part of a massive logistical effort.
So at this stage, there's no report that you're aware of the other way around?
Not that I've seen. I'm more than happy to follow that up, but that's not the report that I got.
Is there scope for senior students to go to remote learning, given the concerns some teachers have about being exposed to the virus in classroom settings when schools go back today?
Well, I think it's really important to send a couple of messages to every parent, every senior student and every teacher and member of staff. We know this will be challenging. We know that this will be a really difficult period, but at the same time, I want all of those people to understand, and all Victorians to understand, that we have followed the detailed expert advice of the Chief Health Officer when it came to making a judgment about the very low risk and the very high reward for having our Year 11 and 12s in metropolitan Melbourne and Mitchell Shire back at school. We do think that remains very low risk. At the same time though, you've got to think about, if you have fundamentally two different ways of learning across Melbourne and regional Victoria, then there is an issue about whether the Victorian Certificate of Education and the Victorian Certificate of Applied Learning actually has utility and meaning right across the state. I think we have to do everything we can to avoid that. We have to make sure that it is one certificate for every single senior student. This is low risk and it's based on the very best medical advice. If the medical advice said something different, Lundy, then those Year 11 and 12s would not be there. They'd be learning from home too.
The number of
What's the
cases
rule with the,
outside.
sorry,
Okay.
for education?
Sure.
Just on that issue, teachers who aren't teaching Years 11 and 12 and are required, is there going to be some discretion for principals for those teachers who might feel uncomfortable coming into the classroom?
There'll be a mixture of both on-site teaching and other support work, other duties that need to be performed in the school setting. There will be some teachers that will be able to acquit their tasks at home. There'll be a degree of, it'll be as flexible as it can be, and I'll give you a couple of examples, Rich. And again, this is done at a local school level because I think local school communities know their circumstances better than anybody at the Department of Education or me. But there will be some teachers, for instance, because of their age, because of potentially underlying health issues, where it would not be appropriate for them to be in the classroom. That sort of judgment is made very much at the local level. But I think the Deputy Premier and Education Minister was very clear yesterday that the default setting is that teachers and staff are back, but there'll always be the flexibility at a local school by school level to put in place the best arrangements.
Is that up to the principal?
Yes.
Professor Sutton.
So also just on education, there's been some reports of students that are just inside the lockdown zone that are going to school outside the lockdown zone.
Yes.
And the parents are trying to take parents in the non-lockdown zone. So this is in Lara, if you want to put a place on it, in Lara. Parents in the non-lockdown zone are concerned about kids coming in that are from the lockdown zone, and they're not allowed to take the students out, staying. And the school is saying to them, if you take a student out, that'll be seen as absenteeism. What sort of
I'm not aware of that particular example, but I'm more than happy to follow that up for you, and we can have somebody come back to you about that particular school. Whenever you draw a line on a map, there'll always be some on one side, some on the other. There's always complexities that are thrown up because of that. I think everybody's doing their level best to try and make this as smooth as possible, knowing that we might make it a little easier, but we will not make it easy. It is a very challenging thing, and I'm very grateful to parents who from next week will have their students at home. I know that's not easy, but we just can't have 700,000 people, 700,000 kids, plus mums and dads and carers moving around the state every morning, every night. All that will do is drive up numbers. On the specifics that you raised, Simon, I'm more than happy to come back to you.
The number of cases outside the lockdown zone rose from 15 to 23 yesterday. We've got cases from Warrnambool to Swan Hill to East Gippsland. As we've just heard, there are a lot of issues around the logistics of maintaining that border around Melbourne. At what point does that just become too hard and we decide that it might be safer to lock down the whole state?
Well, that would be based on the caseload. It would be based also on a proper assessment of the individual circumstances of each and every positive. You could have half a dozen cases in one family, but if you were confident that you had contact traced that as far as you could, it was an outbreak, but it was controlled, that could give you a statistical picture that didn't really speak to the facts of the matter. It might show a big spike in cases, for instance, in a given regional city or small country town even, but it wouldn't necessarily tell you the full picture. That's why the detailed interview, the contact tracing, the 24/7 work that's done to make sure that we're, again, scoping out what's the total field of influence, how many people has a positive case come in contact with for the 15 minutes face-to-face or all the other rules that we apply. And the quicker you can find those people, lock them down, have them tested, that's how you can bring control to something that might look numerically significant, and every case is obviously significant, but something that might give you one picture. If you had it locked down, if you had it under control, then it's in an entirely different category to disease and virus that we don't know about. And that's why getting tested, even if you've got mild symptoms, is such a powerful thing to do. I thank everybody who has done that. I should also do a shout out to the lab technicians who are processing more tests than has ever been the case. As I said before, our rate per 100,000 I think would be number 2 in the world now. It is quite an amazing thing. And I'm very grateful to every Victorian who's come forward, and please keep coming forward to get tested, even if you have the mildest of symptoms.
Is there a danger that we spend huge resources maintaining the border? You know, we're hearing about people spending 2 hours on the road to Geelong today, inconveniencing a lot of people, when we've got virus on both sides of that border, and that maybe our resources would be better spent not having that border, and that it would be easier to have a statewide lockdown? No,
I don't think so. I think that this is not a matter of being convenienced or inconvenienced. This is a global pandemic. It's in many respects a silent enemy, a very clever enemy. It transmits rapidly. It's wildly infectious. You can be carrying this and giving it to untold numbers of other people and have the mildest of symptoms yourself. And again, we're still learning about this. It's a novel virus. We're still learning about it. The way it presents, the challenges that it presents are not completely certain. What we do know, though, is that if we have people moving freely throughout the state, if we have people not following the rules, if we have people particularly going to work when they're sick, not getting tested when they're sick, not following detailed instructions that are given to people about waiting for your test results, about quarantining at home for the 14 days, then we will see this. We won't see 177. We won't see those sorts of numbers. We will see much, much higher numbers. This strategy will work if we all play our part in it, and if we all recognise that we are on the front line, and it's not good enough just to wait for nurses and doctors to be the last line of defence. We can't wait. We can't apply that strategy, because that strategy is predicated on many, many people dying. We don't want to get to that place.
What's the age range of people in intensive care?
I don't have those details. To the extent appropriate, we can try and give you some further information about
First
that.
time around, there was talk of what you suggested, that there would likely be a stage 4. We never got there, but given the numbers this time around, is that something that you're now having to consider?
We're not there yet, but I can't rule out that we have further limits placed on people's movement. I certainly can't rule that out. As I've always said all the way along, if we're planning for it, then I'll share that with the Victorian community. That's not a settled matter at all, and it's in the hands of ordinary Victorians, hard-working Victorians, people in every family right across metropolitan Melbourne and Mitchell Shire, and indeed in regional communities too, because there were rules that applied to them also. If you don't want a stage 4, If you don't want this lockdown to last a moment longer than the 6 weeks that I've indicated, then please follow the rules. Do the right thing by your family, your community, and every family. At the same time, though, let's not lose sight of the fact that the vast majority of Victorians, to whom I'm so grateful, are doing the right thing. And you can see it in shopping centres, on the freeways, in lots of different ways, in people wearing masks. It is a very, very impressive thing, and it makes you proud to think that Victorians are sticking together, and Victorians know and understand that this is something that affects and impacts all of us. The key point is we've just got to stay the course. Otherwise, those sorts of options will be our only options.
Have you looked at a state of disaster, Premier? Have you in recent weeks?
No, we've got the current state of emergency in place. We think that is a sufficient framework. Again, if I got advice that we needed to change that footing, then of course we would. But we've got the powers, we've got the will, and I think that we have the capacity as a state to be able to get through this. It's just a matter of everybody following those rules and understanding that no family will be spared if the strategy doesn't work. And that can be seen in lots of different ways. I'll be standing at this podium having to report more and more people have passed away. I'll have to extend all sorts of rules. We'll have to have businesses closed for longer than would otherwise be the case. We'll have to have people in their homes locked down for longer than would otherwise be the case. This is in our hands. It's a very, very complex, cunning, clever enemy that we're all fighting, but we can get there if we stay the course and if we acknowledge that all of us have got a really important part to play on that. Was there one for Brett or not?
On face masks,
Sure.
some medical professionals are concerned people aren't either wearing them correctly or aren't changing them frequently enough, and they say it could actually do more harm than good.
These are not, just to go back again, because we have an opportunity, there'll be a number of people watching this live. They're not compulsory. We are requesting that you wear them where you're out for a lawful reason and you don't feel confident that you can maintain that 1.5 metre social distance. So whether that be on public transport or down at the supermarket, buying only the things you need when you need them. So that's the status of it. We've ordered the best part of 2 million reusable masks, and we will have more to say about that quite soon, about how they're going to be distributed and to whom. In terms of wearing masks properly, because you're right, there is a significant concern that if they're not worn properly, then they're not of any use at all. Brett's made a video to try and give people some tips on how to do the right thing, and I'm sure that he'd be indebted to you, all of you, if you could move that throughout the community as broadly as possible.
Brett, just how many people test positive that work in hospitals, healthcare workers, and how many are in isolation?
I might just go to contact tracing first, because I just want to make a point. The Special Advisory Group of experts in the UK suggested to the UK government that they'd be stretched if they had to follow up 50 new cases a week, and they should probably stop contact tracing when they got above 50 new cases a week. So I just want to flag that our team are doing gold work. They really are. We are following up every single new case. Now, between 1,000 and 1,500 new cases a week. It is an extraordinary volume of work, and they are following up every single case. We have not given up on contact tracing. On the issue of healthcare workers, look, there have been a very significant number who've been infected. That does relate to transmission from a week, 10 days ago. A lot of that is obviously contact with patients, sometimes with mild symptoms, sometimes even before symptoms have emerged, but healthcare workers are equipped with PPE. They need to make sure that they're wearing it across all settings within the hospital, including when they're interacting with other healthcare workers, even in social engagement in the broader areas of health settings. But it's a risky profession to be in the emergency department in ICU on any of the wards in hospitals where coronavirus patients occur, and so they need to be absolutely mindful of protecting themselves with PPE. Yeah, I'm aware of a case at the Royal Women's as well.
I have a couple of questions about some emerging outbreaks that we're hearing about. Monash Hospital Mental Health?
I'm aware of Monash Health cases as well. Again, I don't have all of the details as of this morning.
Okay, the Melbourne Clinic in
No, don't have it.
Okay, have you got anything on Mantra or on Bell Street?
Yeah, so I'm aware of a case of Mantra. Obviously, it's a Commonwealth jurisdiction. I'm aware that one of the APOD workers there has tested positive, but had not been infectious while at work. Obviously, there are refugees held in that facility. They are a significantly vulnerable population, but my understanding is that there's been a significant clean of that facility, and that the worker who's been identified hasn't been infectious at the workplace.
How useful has the COVID Safe app been?
As I've said before, the COVID Safe app is a very useful tool when we've got a lot of people moving about who might be standing next to strangers, people they're not familiar with, for more than 15 minutes or 2 hours in the same room. The Bluetooth handshake that occurs between phones where the app's been downloaded captures anyone who's been within that 1.5 metres for more than 15 minutes. In Victoria at the moment, with stage 3 restrictions, we're not going to have many people who are standing next to a stranger for more than 15 minutes because people are staying at home.
In terms of before the lockdown, with this outbreak, with our spike, how useful has it been in tracing these people?
Well, we haven't found a number of additional contacts with the COVID Safe app, but if you take the pub outbreak in New South Wales with 600 people who were there for the night, that's exactly the kind of setting where you would hope that the COVID Safe app has been downloaded by a significant number of people, because they will not be known to each other, and that Bluetooth handshake will flag some interactions where someone might be notified automatically by SMS if that linkage has been made.
Menorock aged care, 26 you said, and you have a breakdown on residents and staff, and does that now make it the biggest cluster in aged care? And you were talking the other day about the success that we've had spot fires, but no major clusters, so are you worried about it?
I am worried about it. I think it's a reasonably even split between staff and residents who've been infected at Menorock, but again, I'd have to go to the detailed report in the Chief Health Officer media release this afternoon. It is a concern. I think we're still having success in as much as the vast majority of our aged care cases have been single staff members, or sometimes multiple staff members without residents becoming infected, but they are all at risk settings, and we need to be really mindful of doing rapid lockdowns. The outbreak squads go out on the same day and they do very broad testing of all the residents to identify cases early.
Are those residents presenting to hospital?
This is the biggest one in aged care in Victoria to date, yes.
Are those residents staying to present to hospital now from the aged care facility?
Some of them have been transferred to hospital for their care. Obviously that's both because they are at risk of very significant consequences, but also because it helps to manage the outbreak in those settings.
Are you aware of
17 ICU?
I don't know.
Brett, are you aware of the cluster involving Harvey Norman at the airport list?
No, I'm not.
Okay, that's fine.
And just on Altaqua, I think the whole school community was sent into quarantine on the 3rd of July. That would mean that for those who haven't gone on to test positive, they'd be able to be released on Thursday from quarantine. How quickly after Thursday will you be looking at that school returning, given that we have had 142 cases linked to it?
Yeah, so for Altaqua College, clearly for those who went into quarantine more than 14 days ago, they have an entitlement and they are safe to return. But there will be family outbreaks where close contacts have become positive, where their quarantine period is basically extended. When you have a new positive case, you've been re-exposed to coronavirus as a close contact, then as a student, your quarantine period only ends 14 days after you have been isolated from an infectious individual. So not all students will have an entitlement to return, but I think the great majority will have gone through the quarantine period.
Brett, is it time to switch the strategy and move to an elimination position in Australia?
Look, I think we'd all love the elimination option to be available to us at the right time. Today is probably not the time to talk about it. We absolutely have to get to the other side of the curve and have it suppressed sufficiently that elimination is even something that we can talk about. You have to get to a point where you're down to single digits and days of zero before you can meaningfully talk about elimination, and we are not there yet.
Professor McGorry, just mentioned what this is going to do, and I guess how people will be coping with Yeah, you just talk through what this, I guess, new tool is going to allow you and young people in the north and west to do, and I guess how people will be coping this time around with their before.
I'm happy to talk more broadly, but I'd like to invite my colleague, Professor Mario Alvarez, to come and give you some much more specific information. He's the architect of it. He's been working on it for 10 years. So, Mario, would you like to come up?
Do we want to finish us first? And then
Sure, yeah,
Mario
Yeah.
Mario happy to stay, and then they can do as much as you want.
Well, but Premier, then can I ask you?
Certainly you can.
I
I should have just exited. That's fine, no worries. We're all...
The New South Wales Deputy Premier says he's trying to do the right thing by Victoria to offer to take over the Melbourne Cup and a few other major events.
How very kind of him. I haven't got, Nick, I haven't got time for those really silly games, and that's what they are. We're all in this together, and you know, they're doing a lot of contact tracing up in Sydney at the moment. They've got an issue. We've got a much bigger issue, and we're focused on dealing with that.
Is that being predatory though, what he's doing?
I think I've answered your question.
Are they trying to take advantage of our situation?
I think I've answered your question, and having said that, I'm not interested in playing those games. I'm not about to start playing them, but I've given you a sense of things. I'm sure you've got what you need.
Are you
Last question.
heartened by the development for a vaccine up in Queensland?
Oh, absolutely. I think that any advance in testing, like the saliva test being driven by the Doherty here in Melbourne, any advance in even sort of basic science, a better understanding of this virus is critically important, let alone any advance in treatment or the ultimate vaccine. That's a really welcome thing, really welcome. And I congratulate all of those scientists, all of those doctors and others who are doing a lot of work. It is very, very important work. But even with significant advances, a vaccine is still a long way off. And that's why we all have to stay the course on this, have it controlled, get those numbers down to a very low level, and then we can look to what the future settings will be. But it's heartening to think that we're seeing some significant advances and that Aussie scientists are driving that.
Premier, with the ICU capacity we talked about, at our present trajectory of new cases, do you happen to know when that's going to start bringing us up to capacity and what's available in the ICU?
Well, I think it's important to understand that there's a number of facilities that have been boosted. They don't have patients in them now. That's exactly the way that we want them. We don't want those facilities full. We want them there so they can be a surge centre in the event that we finish up with many more patients in hospital and many more people requiring that one-on-one care. That's not where we're at now. We have sufficient capacity to deal with the numbers that are presenting at the moment. But again, if all of us want to see less people in hospital, if all of us want to see less burden, less risk, less danger for our nurses and doctors, then we all need to follow the rules. We all need to stay the course on this for ourselves, for our community, for our state, and most especially for those nurses and doctors who will be the ultimate line of defence if we don't do all of this important work, make the sacrifices we're making and stay the course for these next 5.5 weeks. We have sufficient supplies, everything from PPE to machines to help you breathe. We've trained up additional staff, but as you can see in these numbers, when you start to get significant numbers of people in hospital, you do then finish up with significant numbers of staff that finish up contracting the virus. They and their close contacts have to then be taken out of that workforce. That does put some pressure on. It's not easy by any stretch, but we're confident we have the resources we need.
Do we have a number for the surge capacity? I remember at one point that phase one we were up to like
Sure.
1,000 beds.
I would know. I don't think it's wildly different to that, but I'd need to come back to you. If you're okay with that, I'll get Jenny's office to come back to you.
Thank you.
Can I just quickly get Professor Sutton on the face mask? Thanks, sorry.
You certainly can.
Just back to that with people not changing them frequently enough. Some medical professionals say it won't only be useless, but actually be counterproductive. Do you have concerns about that?
Not generally. I think for individuals, yes, you can use a face mask in a way that makes it more dangerous. But the Lancet meta-analysis that has really changed our view on masks and been pretty clear is that in general use, with all of the imperfections about how people understand them, with people sometimes wearing them over their mouth and not their nose, or not tightly enough against their face, with all of those imperfections in behaviours, it still limits transmission quite significantly. And it does it for a couple of reasons. One is because even imperfect use will limit some of that transmission, but also it seems that people stand further away from us when we're wearing a mask, which is a double protection for us. So I think the Lancet view was that overall, close to universal mask usage is a really significant driver down of transmission. So I think I would just give it the thumbs up, make it a recommendation for anyone in our Melbourne and Mitchell Shire areas, and a consideration for anyone outside of that if they're vulnerable, if they're going into a setting where they're concerned.
Have we had anyone in Victoria get coronavirus twice? I know we have had a bit of that overseas.
Yeah, I'm aware of a case in the US who appears to have gotten it twice, certainly not in Victoria that we're aware of. There might be some persistence of finding virus in some people where they actually haven't got it twice, it's just been reactivated or it's been detected and it's essentially dead virus, but I'm not aware of anyone contracting it twice. Thank you.
Any other issues for us? If not, we'll leave you with Pat and Mario to talk about the technology and support for younger Victorians, particularly in the north and the west. Just finally, this is not an ordinary week. This is not an ordinary winter. Each and every family across metropolitan Melbourne and Mitchell Shire needs to be at home unless you're out for one of those 4 lawful reasons, and you're only out when you absolutely need to be. I know this is challenging, it's frustrating, it's not the position that we wanted to be in, but I want to thank every single Victorian who is doing the right thing, and I just urge those who aren't, make better choices for you, your community, and for all of us. And if that's not enough of a motivation, well, Victoria Police are out there in force, and you'll finish up with a very nasty fine. Thanks to everyone who's doing the right thing. These numbers today are better than might otherwise have been the case, but let's not get complacent in any sense. We've got a long, long way to go. It is seriously one day at a time, one family at a time. Everyone doing the right thing will get us to the other side of this. Thanks very much. I'll probably see you tomorrow.
Mario, do you want to
Mario, can you tell us your full name and who you represent to start with?
Absolutely, thank you. So my name is Mario Alvarez Jimenez. I'm a professor at Melbourne University at the Centre for Youth Mental Health. I'm also the director of Origin Digital, which is the digital division of Origin, which is our leading youth mental health research and clinical facility. Yeah, I mean, look, I explained to you the best I can. So we're incredibly excited, of course, about the rollout of this new digital platform. So it's something that we have been working on for the past 10 years with multiple iterations. So it's very unique. We call it moderated online social therapy, and it brings together online social networking for young people to be able to talk to each other and to support each other, but also high quality evidence-based online therapy together with clinical support so young people can access clinicians, but also vocational workers so young people can find support in terms of finding work and employment, and peer workers as well, young people with lived experience who speak their language. All of that integrated with face-to-face services as well. One way of putting it is think of Facebook as a social network that is being designed to capture attention. So we've re-engineered most to enhance social well-being and also to be integrated with face-to-face services. So it is a platform that has been designed for and by young people. We've done very extensive research with it. We know that it works. We know that it's appealing. And it really follows the demands of young people. And if I may spend just a minute with this. So we know that young people want digital technologies that are integrated with mental health services as opposed to digital solutions that bypass services or replace what is already available to them. So following that demand, we created most to really digitally enhance youth mental health services to increase their accessibility, their impact, and the long-term effectiveness as well. So that's some of the characteristics of the platform.
What are you saying at the moment of people reaching out for mental health support? What's your concern, I guess, for either of this about the current impact on young people of the lockdown?
Yeah. Well, we are seeing obviously a surge in terms of help seeking. I'm a clinician myself, and you see this on a daily basis as well. Young people very worried about the social isolation that they're facing and the difficulties in terms of being able to access mental health services as well. So it's something very noticeable. There's been also data in terms of increased demand in services. I mean, this platform that we've developed in some ways is an antidote to the social isolation that young people are experiencing in these uncertain times, but also the reduced access to services because of obviously COVID, but also beyond. So,
Professor McGorry, can we just ask you in terms of the towers in particular? This has been rolled out for the north and west, but obviously the towers.
Yeah.
Just how do you see that being a huge mental health issue for young people in those towers in particular?
Yeah, thank you. It's a great question, and the Minister basically has asked us to focus on that now, and so Mario's team are definitely getting to work on that, how to actually tailor it for that group of young people, which, as you say, are very much in the frame for very high risk actually. So we will, over the next few days, actually put our minds to that as to how to tailor it more specifically and make it the top priority.
So what do you see the problems there being in the
Oh,
town?
okay. Well, I think it's pretty obvious, isn't it? I mean, it's just a perfect storm of social isolation, stress, fear, anxiety for those young people. And as Mario said, young people, we know that young people are the highest risk group for mental health generally. We know in the context of the pandemic they're the highest risk group too, because their whole futures are being put under a cloud. Their vocational prospects, all of those things it's really a perfect storm for them. So that's why we're very appreciative that the government's actually supported us to really scale this thing up, which Mario's been working on for 10 years. It's evidence-based. It's not like a fly-by-night app that's here today, gone tomorrow. This is a whole platform of care that's interfaced with the face-to-face. And you know that in Victoria we have a Royal Commission, thanks to the Premier and the Minister here. Mental health reform is being taken very seriously in this state. It's being modernised, and the Premier described it as a broken system. We have to build a new system, and this, what you've just heard about today, is an absolutely central pillar of that new system. Modern digital technologies being interwoven with the face-to-face, the more traditional sorts of approaches. So this is a fantastic development actually, and it's one of the positive things you can actually say about the pandemic, that it's put the reform challenge right at the front of health reform. The mental health challenge is going to be the second curve. We've modelled this. We expect a 30% increase in need for care for mental health over the coming months and years. And we've got to position ourselves for that challenge. And digital mental health, which in Victoria, we are the epicentre of digital mental health reform in the world now, and of youth mental health reform. So we've got a great opportunity. The Royal Commission will get behind this, and the Royal Commission will actually transform the mental health care system in Victoria. I'm intimately involved with it, got a lot of confidence in this process, and the government is clearly backing this, and this is another example of that today.
Any general advice to people?
Sorry?
Any general advice to people as to how to look after themselves?
Well, you know, a lot of it's common sense, isn't it? And there are lots of websites that tell you what to do. You know, stay connected, all of that kind of stuff. Try to exercise. Try to do the simple things: sleep, exercise. That's been said for months, hasn't it? But these new dimensions, the digital perspective, is another thing that we can actually help. And I think also, you know, we've seen a lot of publicity about Lifeline and Beyond Blue. That's the first step. That's the kind of first responder bit. We've got to build some capacity behind that first step, so that if people really do reach out for help, they actually get it. You know, you reach out for help if you've got a runny nose or a sore throat. You reach out for help with mental health, and it's pretty thin. So we've actually got to make sure the access to care, to expert care, is really strengthened. And I'll just give you a couple of stats. We can predict that during the last 4 months, we've lost 108 people from COVID, right? That through this fantastic effort that we've made in Australia on this front. During the same period, we estimate about 1,000 people from suicide around this country. 10 times as many people have died from suicide than from COVID in the last 4 months. So mental health has to be taken a lot more seriously as a public health issue. We've seen the power of public health in this pandemic. Can we devote the power of public health to solving the mental health crisis? That's a rhetorical question for all of us.
Is that 1,000 more than you would normally?
No, that's the total number. We actually don't know in real time yet whether the actual number is higher than it normally is. But my suspicion is that it certainly will get higher because we've got really good modelling that will say that it is going to increase as the pandemic unfolds. So we lose 1,000 under normal conditions. It might be as many as 1,200 or 1,500 under, more extreme conditions. So we've got to take it more seriously. These are still lives. These are Australians that are dying in these numbers. And we've got to take it a lot more seriously.
What role does unemployment play in that? Is that a big driver?
Yeah, I'm glad you asked that. Great question. The economic and social drivers of those suicides are the really powerful ones. All the modelling shows that if the unemployment rate goes up, and it's probably 2 or 3 times higher in young people, that is the driver of those more desperate sort of pathways. But the final common pathway is a person in intense psychological distress who can't see any future for themselves. So there's lots of opportunities to intervene and save those lives.
Thank you.
Thank you.
Thank you. Thanks, Mario. Thank you, Rosalie.
You won't need a gym workout after that. Well earned.